Hi, I'm Mark Olives, and today I'd like to give you one quick tip that will help if you have spinal disc problems. If you haven't seen my other video to how to diagnose the difference between a disc problem and a joint problem, I'd advise going back and watching that first. But if you're pretty confident that you have a disc problem in your spine, this should help you out. So first I'm going to tell you a little bit about the dynamics of the disc so that you can understand kind of what's going on, so that you can understand what you're trying to achieve. The fact is, the disc is a spacer that sits between the bones. It's actually connective tissue that holds the bones together, but inside of the disc it's got a fluid component. So when I compress one side of the disc, it's going to drive or shove the material to the opposite side. In the case of the disc, the only place you'll ever herniate a disc is on the back side. So when you bend forward and compress the front part of the disc, it drives the disc material to the back, and what that's going to do is put more internal pressure on that part of the disc that's injured. It's going to want to bulge it out farther and stretch it, and it's going to irritate it. So it's pretty easy to see if that's an irritation. Probably what I want to do is just the opposite. I would like to compress the back part of the disc, drive the disc material forward, provide some relief so that the disc now is able to heal itself up. So the best thing you can do is frequently lay down on your stomach and either just rest your body on or rest your chin on your fist, or rest up on your forearms. This is a passive activity. I don't want you to strain and be lifting and utilizing muscles to achieve this. I just want you to lay there like you're a kid watching TV. So if you do that, you'll get some movement of the disc. Keep in mind it takes about an hour for the disc material to move from one side of the disc to another one. So it's a slow process. However, if you sat on the ground for an hour, number one, you'd drive yourself crazy. Number two, you'd probably provide some irritation to the joints and cause some other problems. So I tell people don't do it for that long. But 5 to 10 minutes at a time is a great time period to do. Start very slowly, start low. Start with just your chin on your hands at first, and then if that's okay, then you can progress to just resting up on the forearms. More is not always better, however, with both time and inclination. So don't feel like, well, I'm just gonna go for broke and I'm gonna play through the pain. No, don't do that. Go with the most comfortable position. All we need to do is get enough compression on the back part of the disc that it will drive to the front and provide us some relief. And if you can frequently do this throughout the day, that will help, especially if you're in a position where you've got a sedentary job, where you're sitting a lot, or you're in a car driving a lot. Well, you're getting a lot of pressure on the back part of that disc, and you need to do something to relieve or counteract that, and that's driving that fluid to the opposite side. So that one little exercise can greatly help reduce your pain and help your disc to heal up. I hope this helps you out. Thanks.